Welcome to my presentation, Putting the Ball in the Patient's Court. My name's Aerin, and I'll be talking about gender-affirming hormone therapy in U.S. family planning clinics. My qualitative study asks, what are transgender and non-binary patients' experiences with medical decision-making while receiving gender-affirming hormone therapy in these clinics that are sometimes referred to as abortion clinics? Here, medical decision-making refers to how providers and patients reach decisions about that patient's treatment. I do want to note that not all trans people pursue hormone therapy, but this study looks at folks whose transitions do include that. Pursuing medical transition as a trans person can be deeply profound and personal. And the way that a provider treats their patient, both interpersonally and medically, can have an enormous impact on that person's well-being as they're navigating this life-affirming process. I'll speak more to the importance of this after getting a little bit into the literature. Many studies in the last decade have documented the disproportionate barriers, negative experiences, and negative health outcomes that trans and gender nonconforming folks face in the healthcare system. There's also literature on how historically uneasy relationships between medical providers and their trans patients can leave these folks in vulnerable, disempowered positions. The original shared decision-making framework by Peak was created outside of the context of trans healthcare, but there is a growing body of literature applying patient-centered and patient empowerment approaches to transgender medicine, some of it urging providers to place more trust and decision-making power in their trans patients, essentially treating them as the experts of their bodies that they are. What's missing is literature addressing the specific decisions that go into providing gender-affirming hormone treatment. These include things like, am I going to start on 0.5 milligrams of testosterone or 0.2 milligrams? Do I want to administer my hormones via injection or by putting a patch on my skin? How will my hormone treatment interact with my medications or my other health conditions? And how might that impact the decisions I make around these hormones? So these specifics are particularly important because though advancements in transgender medicine are allowing for more effective and individualized treatment, current hormone treatment guidelines don't have a solid foundation of scientific evidence still and aren't often included in post-grad medical training. So it's not surprising that 50% of trans patients report having to unfortunately explain their medical necessities to their providers due to a lack of provider knowledge. So again, why is this important? In the absence of robust data and training on hormone treatment, there's a great need for effective decision-making around unknowns. I'm going to gloss over this part quickly. Please ask me questions about it later if you have them. So our team of 4 identified eligible family planning clinics through their websites and invited them to help with recruitment. We conducted qualitative interviews, which were then professionally transcribed. We used a software called Deduce to do ongoing thematic comparative analysis guided by modified grounded theory. And my project focuses on a subset of the data related to a theme that emerged around hormone-related decision-making. So I kept an eye on codes like dosage or medication options. I also went back and reanalyzed the data with codes that we didn't have in our initial code book, and one of those codes was patient-provider collaboration. So our sample of 34 participants represents 13 clinics across 8 states. The participant age range was 18 to 66. And here are racial and gender demographics that I'll give you some seconds to take in. I'll be discussing each of these themes in detail in the coming slide. But what emerged was first this theme of patient-provider collaboration and patient agency. The second theme of how providers responded to requests for adjustments in medication. And the third theme was around a desire for more provider knowledge and more tailored treatment. So patients appreciated when their provider explained options and took a collaborative approach. Patients reported that their providers really let them lead. They described being asked about their goals, satisfaction with their current dose, and any desire to increase or decrease that dose. Medication and doses were often determined collaboratively, factoring in patient preference and cost. And many patients felt that they were presented with options rather than being told what to do. The second theme that emerged was that providers actively invited and accommodated requests for changes in things like dose and administration method. Follow-up appointments included questions like, how is the treatment feeling? Do you want to increase or decrease your dose? And these changes often resulted in positive outcomes for the patients, including satisfactory progress with their physical changes, enjoying a more preferable form of medication administration. In the case of this last person, they had an aversion to needles. And another positive outcome was that patients felt a sense of choice, like they had a say. So the data shows a positive relationship between patient satisfaction and patient-provider collaboration. Lastly, despite these experiences of autonomy, some patients wish their providers had more knowledge to offer in the decision-making process. Some express the desire for more specialized knowledge in endocrinology, which would allow for risk prevention and more tailored treatment. Some described that everybody's hormones and hormone therapy needs are unique. A lot of individual needs came up in the data, including low responsiveness to the starting dose or negative side effects like menstruating if their testosterone was too low, or having questions about their birth control implants or their diabetes medication or their high blood pressure and how that will interact with the treatment. Some patients reported that their provider was using outdated information or didn't have answers to questions like the ones that I just posed. So the value of patient-provider collaboration seems to depend partially on the level of provider knowledge. So here I'll conclude with a brief discussion of these findings. Data showed high patient participation in determining hormone dosage and selecting medication options. Patients received treatment in accordance to the most current standards of transgender medical care, and providers demonstrated flexibility and patient-centered approaches to addressing individual needs. Although this data can't be generalized to all transgender populations and only examines care in the context of family planning clinics, it does support existing literature on the utility of shared decision-making and patient empowerment practices. Future research is definitely needed to investigate in shared decision-making tools, health outcomes, and individualized treatment in the context of gender-affirming hormone treatment for trans and non-binary patients. More robust medical guidelines and trainings also need to be developed. In closing, I'd like to express deep gratitude to everyone who participated in and supported this research and my journey as a student. Thank you.